Okay, good afternoon, everyone. I have three clocks in front of me, and two of them say 3 o'clock, so I'm going to go ahead with those two and get started. Thank you very much for attending our office hours today. We're going to be discussing the security risk analysis, which is part of the promoting interoperability category, and we're going to talk about using the SRA Security Starter Toolkit that we have put together and is actually available for download. If you click on chat, you'll see actually two files that are available. I am Christa Thompson, and I will be your presenter, but I have lots of backup from Tabitha, Neoshi, and Kelly, so I'm very appreciative of that. As I mentioned, if you go to the chat, there is a download of the slides today. There's a download of the Security Risk Assessment Toolkit. And then if you download the slides, you'll have this link to our April newsletter, which is on the same topic. So we want to get an idea of where you are currently in your situation in doing a security risk assessment. Tabitha, if you'll put the poll out there for us, and if everyone will let us know if you have ever participated in performing risk assessment or never participated. I'll give you a couple of seconds. Okay, Tabitha, what say the poll? I don't hear you. You must be on mute.
It looks like we do have participants that have performed a security risk assessment previously.
Perfect. So now throughout this, you can score yourself on how well you've done in the past. All right, so what is your role in completing the risk analysis? So since you have done one before, do you complete it? Do you work with everyone in the practice? Do you need someone to help you in completing it? Which we can definitely do. So Tabitha, if you haven't already, put that poll up for us. And I'll give you a few seconds. I have to say, if you work with a group, then congratulations, because I know there are plenty of small practices that don't have enough resources, and it tends to fall on the shoulders of one person. Okay, Tabitha, what have we got?
So we have 67% say they will be completing the SRA, and 33% say they will be working as a group.
Okay, good. So there are some people that have that blessing. Okay, so here's the boring security rule, which really says, you need to conduct or review a security risk analysis. So once you do your first one, you can just review them after that. And all these great numbers and letters, you can Google any of them and they'll give you the exact verbiage of these pieces. And this is to include addressing security of your electronic patient health information. So that's even including encryption, and it's part of your certified electronic health record that you're looking at, but not just the health record. There are other pieces of it. Anywhere that you might have EPHI, which is the electronic protected health information, you want to go through an analysis, look at the potential risks, any vulnerabilities, and even looking at not only equipment, but your business associates, so on and so forth. And then you want to take reasonable and appropriate steps to reduce the risks. We know that you're never going to be able to address every risk. As an example, viruses, there's new viruses that come up all the time. Social engineering, there's different ways they do that. Trojan horses, all those good things. So you're never going to be able to completely 100% get rid of risk, but you want to do the best you possibly can. And it's an important part when it says you must take any additional reasonable and appropriate steps to reduce the risks. We'll talk about why that's important as we go forward. So that's the rule. Now let's talk about actually doing a security risk analysis. So the first thing to do is collect all of your required items that you're going to be looking at. So these are all the things that you want to pull out and you want to make sure you have, and they're all together correctly. And if you gather all this stuff together right away at the beginning, it just makes it go faster and easier. So the inventory list and all these, the business associate, we're going to talk in a little more depth about all of this stuff. So your inventory list is hardware and media that contain the electronic personal health information. So some people have fax servers, and there are things saved on a fax server that might have electronic PHI. I'm going to start saying EPHI just to save myself some time. It could be, hopefully nobody has put patient information on a thumb drive because there's a lot of risk with that. So one would hope, but maybe there are situations where that really is necessary, especially in the time of COVID when people are working from home. It could be that you're going to have things that you're going to take to your house, but you want to make sure that you have policies and procedures in place that cover those risks. So those are the things that you're looking for in your inventory list. Sometimes just walking around the office and looking at things and thinking about workflow. So throughout the year, it might pop into your head, oh, I never thought about, this PC sitting over in the corner that we rarely use. I need to make sure that I consider that in the risk assessment. And here is just a really simple network diagram. Now, if you have someone that does your IT stuff for you, then they should definitely have a network diagram for you. And we recommend that you get a copy of it. And all of these things, you want a folder for each year. So you create a folder. It's good to have a hard copy and an electronic copy. And each of these pieces, you want to put it in with the appropriate year because you're going to, of course, have changes over time. So if an audit is done on a risk assessment, you want to make sure that whatever was pertinent at the time is what an auditor would be looking at. And if you don't have an IT person, draw it on paper. It's fine. It just kind of helps or think about, all the pieces where there could be a risk is what this diagram does. You want a business associate list. So let's say that you have backup tapes and you have a company that comes and gets those backup tapes and holds them for you to be safe. And so you have all your data. You want to make sure that you're listing that company. Do they have access to the facility? Some people that you work with will not. Someone who, picks up tapes, they may have that. And then what is the information that they have access to? Is it, the other thing is the EHR vendor is a business associate. So what do they have access to? And this just helps these are the types of things that you want to be aware of. I mean, something could happen with some vendor that's dissatisfied with you, and then they, do something as far as sabotage. You want to be able to kind of look and see, okay, who has access, who possibly could have cost us this or caused us this heartache. This is just a little bit of a sample in the risk assessment toolkit that you can download. There's a sample in there as well. There are plenty of places for you to look and get, but this, of course, is from HHS. So this is a good sample. This is the kind of thing that the Office of Civil Rights looks for when they do audits. This is a sample confidentiality agreement. Also, all of these things that I'm going to be showing you are in the toolkit. So you want to make sure, you know, I've worked with a lot of practices that have their employees sign this when they start working, but not necessarily annually. But because you're doing your risk assessment annually, it is good to have the confidentiality agreements done annually. Make sure you're doing your security risk training annually, and you have some documentation that that happens with your employees. And really, when you're going through the risk analysis, it asks you about those things. You know, are you doing the training? Are you keeping up with it? Does it cover this? Does it cover that? All right, so also in the kit is the IT security policies and procedures. So this is just the title page showing you here, but this is a very comprehensive document, the policies and procedures, the sample. So years ago when Meaningful Use started, we were actually a regional extension center, and there were, I think, 68 maybe in the country. And so people all across the country worked together to put these policies and procedures together, and really went through the HIPAA law, the things that the law covers, and made sure that everything in that law was addressed in these policies and procedures. Now, that was several years ago, so there could be new things that you have. You want to make sure that you're documenting in your policies and procedures. But when you start going through your risk analysis, it's going to ask you questions that would be covered with these. So there's a couple of situations I found. Sometimes there are no security policies and procedures. So definitely I encourage people to just use this and make it their own. There might be things that don't fit for you that you can delete out, or there's things that are not covered that you do want to include and add to it. And then there's the situation where some have all of their policies and procedures in hard copy only and not electronically. So moving it from hard copy to electronically is good. And then you can use this sample to do that, essentially recreating it electronically. So people have found that very helpful. And if you're doing that, we know that all the things that are in the risk assessment are covered in this set of policies and procedures. Tabitha, do you have anything to add, or Miyoshi, Kelly, anybody want to add anything so far?
I think you've covered most of it. Did you say about keeping things on hand for 6 years, or so that they have it if they need it? With the policies and procedures, I usually tell people, you want to make sure if you make any changes or update those, that you keep the original policy and then a copy of what the new policy is. Because if you do get an audit, you want to be able to refer to the policy that was in place at that time. And if it's changed, that's okay. We just want to be able to document what was current at the time the process was done. That's the only thing I can really think of right now.
That's why I asked, because I know I don't remember everything. Thank you very much. All right, a security officer position description. This is something that you definitely need to have. It's within the risk analysis, and sometimes that's the office manager, or sometimes it's a nurse who does the risk assessments, in a small practice. So a lot of times what I do is just suggest that there's a few lines added to um, a position description. So as a practice administrator, office manager, whatever your title might be, if you are the person that is doing the risk analysis, then there can be some verbiage added to all of the other long list of things that you do in the practice, because we know everybody in a small practice wears a lot of different hats. All of these things that you're looking at and that we're talking about are for you to be covered if there were any kind of a breach in your EPHI. So if you had any kind of a problem and you were audited and no one is responsible for the risk assessment or the security in the office, that's a problem. I'm not going to say you would be fined. I'm going to say that would be a problem. The biggest fines come when you have never done a risk assessment because it is part of the law, or you've done a risk assessment, you identified a risk, and then you did not address it. So I said that would be one thing we would talk about again. And I'm not done with that. Okay, so this one, I don't believe it's in the toolkit, but there's a link right here. So if you download the slides, you can get this. There is a security officer sample in the toolkit. It just doesn't happen to be this one. And on the list of things to gather, we talked about the previous security risk analysis. And if you have a previous one, you can breathe a sigh of relief, because I know that first one is a lot and is very tedious to get through because there's a lot of things to look at. So if you have the previous one, then you can go through and just update. You don't have to look and make sure, do you have that policy or you don't have that policy. That's another great thing about that security policies and procedures that we have. If you use that for your initial risk analysis and you know everything is covered and there's nothing really new, then you can go through those questions pretty quickly. You can just say, oh, this asks about a policy, and I already know we have all the policies. So it's very helpful if you have your previous risk analysis. And if you have done one, you definitely want to have it in case of an audit. Okay, so now we're going to talk about the actual tool and doing the risk assessment itself, that piece of it. So this is just a picture of our tool that we have edited and updated. So again, when we were part of the Regional Extension Center, and that was really under the direction of the ONC, the Office of the National Coordinator. So it's a tool that is attributed to HHS, really. And so we all put this together, and it asks all the questions that are related to the law. You don't have to use this one, but it is in the toolkit, and it does have every question that would go with the law. And I know this is really tiny, so I'll just kind of do some, oops, let me go back. So this section right here is the question. This is the answer. Now on the tool, there's a little drop down where you choose yes or no. Do you have this? Do you do it? Some of these questions are, is it applicable? Sometimes the questions seem like they're redundant, but if you really read them, they're asking, one of them might ask, do you have a policy and procedure for this? And then the next one will ask, how do you do it? But it's about the same topic. So it feels a little redundant, like you're just answering the same questions over and over again, but there's just little nuances to it. So on the tool, you can flag a question if you want to. So, in the first iteration, you might just be going, fairly quickly and answering the ones and flag the other ones that you're going to do some research on. You can do that. And then in the tool, it's an Excel sheet, and there are different tabs, and there's a tab for you to go back and look at your flag questions. You can change your status, is it open or have you already answered it, to let you know, you can do some sorting to make sure you've got everything. Now, the law asks you to look at the impact that a breach might cause, or if you have a problem. Let's say, there's a tornado. What is your risk level? Well, if a tornado flattens your building, your risk level is definitely high. What is the impact, it's going to be devastating. And then what's the likelihood? Well, if you live in the Midwest, your likelihood is definitely going to be higher than it's going to be if you live in East Tennessee where there's mountains all around, and very rarely does a tornado hit. So those are all things that you're going to be looking at. And when you find something with a high risk level or a high impact or high likelihood, those are things you want to look at and say, is there something we can do to reduce this risk? And if there is, and this is not included in this little bite, but over to the side, there is a spot for mitigation. And this goes back to addressing any risks that you might have. So this top question that I know you probably can't read says, does your practice develop, document, and implement policies and procedures for assessing and managing risk to its EPHI? So do you have a documented policy or procedure, which if you're using those policies and procedures we talked about, the answer to this is yes. But if the answer were no, then in the mitigation, you want to make sure that you're documenting who is going to mitigate this, when they're going to mitigate it. So you want a date, and it needs to be within a year, or I should say it needs to be within the period of time of your next year. So if it was June and you were really looking at your MIPS reporting year, June of 2020, and you were looking at your MIPS reporting year of 2021, you could do December of 2021, but you don't want to put it off, you can't put it off 5 years. You just want to make sure that the next time you go through your risk assessment, it's addressed. So who is going to do it? When are they going to do it? And what are they going to do? That needs to all be documented. We had some audits of risk assessments during the meaningful use days, and that was one of the things that they were very adamant about, and potentially was a problem for those audits. So make sure you do that. And then for this one, Mary Jo is going to document the process, and she'll do that by October of 2021. So that's the gist of really what this, there is administrative questions. Those are the things that are about your policies and procedures. There are technical questions. Those are going to be about your EHR and EPHI. Physical questions. Do you have locks? Do you have alarms? Do you, they even ask, do you have some sort of log of any changes that were done if you have a server room or something like that? Some of these things may not apply. And so you can definitely answer no, and then in the explanation say it just doesn't apply. There is an explanation area where, you can explain why you don't have it, that sort of thing. The other thing is, some of these are required. So there's an area right here way off to the right, and it says status type. And the first one is required, the other two are standard. So they are standards. You still want to have those in place, but required, the first time you go through a risk assessment, anything that's required, you want to address that immediately. And then you have, I forget the word. Tabitha, help me with that word. You have ones that are, it's kind of a, you want to have this in place, but it may not be that it applies to you. What is the word, Tabitha?
Standard.
No, it's the other one. There's required, standard, and then I think it starts with an A. Well, anyway, essentially what it means is, a question, are you protecting your data with encryption? You might say, no, we're not using encryption because we found that encryption affects our ability to to have patient records available on demand when we need them. That's not something that you would say today because things have changed, but years ago that was a thing. So it might be, do you have this? You say, no, but here's the reasons we don't have it. And in place of that, or instead of that, what we have is ABC. So there's 3 different types of status. Anything I'm missing, Tabitha, Neoshi, Kelly, about the risk assessment itself so far?
Well, and I was going to say the third one is addressable.
That's it.
Mm-hmm. The only other thing I can think of, sometimes I've worked with sites and they're hesitant to answer no, and that's okay. We're doing this process to see, is there anything that we need to look at? And that's what we're saying when we say no. We want to look at this process and see if there's anything we can do to make sure that we're secure in that area.
Yeah, absolutely. Yeah, you don't want to say yes if the answer is really no. And you also don't want to pile too much up upon yourself. If you have a lot of no's, it's better to just let it be that and then address them over the period of a year than try to address all of them, within this first cycle that you do one. That's too
Exactly.
overwhelming. Yeah.
Yeah, like if we work with a site that doesn't have written policies and procedures, we know those are going to be answered no, and we know that's something we're going to be working on for the, ongoing process.
Exactly. And the truth always comes out. Okay. So here are some final tips for success, which we really talked about, most of these. Get those items on your list together. It just makes it easier, goes faster. Contact us. Let's make an appointment. We can look at it. We can help you with it. More than likely, you're going to have questions. You're going to want some suggestions on how you might do better, or you may find, risks or problems, and not really know exactly how to address them. So definitely just let us know. Make sure you download that toolkit we have in the chat and take a look at it. See if there are pieces that you can use, things you might not have thought of in the past. And then if you do want some help, you can share the checklist and the pieces of the checklist with us. That helps us to help you. Set aside time to work with us and complete the items on the list. And even if you're doing it on your own, I always tell people work on it a little bit each month. Breaking the big task down into smaller. I mean, everybody's heard that before. It's not news. But sometimes we don't listen to ourselves. So you want to do that. Another thing that I tell people is, the confidentiality agreement, the training, the sign off that they've had the training, all those kinds of things. You could do yearly. People have talked about they've got OSHA and this training and that training and this thing you have to sign. And for QSource, all of that gets done in the fall. And it's like every time I get an email about, oh, you need to do this training, oh, you need to fill out this form, I just get exhausted with it, which everyone does, I know. But you could split it up and just make sure that annually in April you do OSHA training, and then annually in October you do security training. You don't have to all do everything, but you just need to make sure you're doing it annually. Read our April newsletter, which there's a link to in the slides for today. And so I'm going to, Tabitha, are there any questions that have shown up in chat?
We do have someone asking about the handouts, and if you are able to pull the chat up, if it will let you scroll up, they're up above the poll. but we can probably put those in there as well.
Yeah, if you, I mean, we could always email them to you. So if you need us to email them to you, yeah, it is true. You would have to scroll up some. And I've been reusing this meeting. So there's a lot of stuff in that chat that's from previously. I won't be doing that again, but this is a new tool that we're using, the Microsoft Teams. So I'm learning as I go. But if you do need that to be emailed to you, just put your name in the chat and we'll make sure we get copies of those two things to you. No problem. Any other questions? You might be on mute, Tabitha.
I see some people posting their email addresses, but I do
Okay.
have another question.
Okay, great. All right, so now let me ask Tabitha, Miyoshi, Kelly, do you have any last things you want to add? Just peep in if you do. So we have some resources that you will have also on the slides from today, which I will email you. And as always, contact us if you need us. I think we've worked with everybody. When I looked at the registration list, there were so many people that I recognized. So you probably already know us, but here is contact information in case you do not. Let us know. You may have received an email about this from us. We sent out a blast today about it. But there was some company that was sending out postcards telling practices to email their risk assessments to them. And the postcards looked as if they came from the Office of Civil Rights. So I don't know if that's happened to any of you, but that the link in there was not real. I think that it's from what I could tell, it looked like it was a company that was marketing with that postcard, but the way they sent it, it looked very official. And so never ever do you want to send your risk assessment to anyone unless you know who they are, what they're going to do with it. I mean, it's not like EPHI, but still, nevertheless, it's not something you want to be sharing. People that you don't know can take advantage of lots of information that you might have available. So it's like anything else. Just be careful about links and email addresses that you get. I even got one day that I came really close to, and I know better. And I've been dealing with technology for more years than I'm going to admit to. So I know better, and I still came very close to causing myself some issues. So just have to be aware that people out there are like that. So that's it for the risk assessment and that little news tidbit. So you are free to go and enjoy the rest of your day, do whatever it is you'll be doing. But I'll stay on and talk a little bit. And if you guys have questions, just put it in the chat. We'll be happy to help. So what I do want to talk about, just which has nothing to do with risk assessments, is I've been working with a lot of practices recently, that have been doing MIPS. What is this? I think it started 17, 18, 19, 20. So this is the 5th year that people have been working on MIPS, and some have been working on meaningful use for years. That really started in 2011. So that's 10 years. Wow. Yeah, I've been with QSource for 10 years. And that's when I started, was when meaningful use started. So, and then there's PQRS, which had been around for a long time. So those legacy programs, got all wrapped up in just the one program, MIPS, with the different categories. But So people who've been doing it for a while and gotten better at it are, looking at the things that they're reporting to see if there are other things they can report to get better scores. Now, you may not be interested. Plenty of practices are like, I've got lots on my plate. I don't have time to worry about that. But if you do want some help to kind of look at, especially the quality care category, we can look at, so in the quality category, there is a benchmark tool that we can use to see if you report via claims, if you report via your EHR, or if you report via a registry, there can be different benchmarks. So, in other words, one type of data submission, you might get 10 points if you're between or anywhere above 80%, but another data submission might require you to be at least at 90%. So we can look at all those little nuances on things that we might be able to help you increase your scores. If you're interested, just email us and let us know, or call us. That's one thing we've been doing. We are currently working on a cost toolkit that is really good to talk about the things that you can do in your practice to increase your cost score, which is really important because each year the cost becomes a bigger portion. Now, a lot of specialists do not even have a cost score, so you'd want to go and look in your previous performance reports. Do you even have that? And if you don't, then it's not as much of a concern. But if you do, then you definitely want to be paying attention to that. Also, another thing that we're working on that will be put out there pretty soon is some little bites of information, I would say. So just little videos that are like 5 minutes long that talk about the types of things that we talk about in our office hours, but just little snippets of it, so you don't have to be overwhelmed with too much information at one time, and everybody's got lots of things to do. The videos are kind of cool, easier to watch. So if that's something that you feel like you could learn more from, that's coming on the horizon. We're working on that right now. If you haven't already, definitely be running your reports, kind of see where you are. We're already 4 months into the year, so there should be data for you to kind of look at. If you can run it from your EHR, it's good to do that. Tabitha, Miyoshi, Kelly, anything else you can think of as far as tips for right now?
I guess my number one would be just, if you haven't started, don't think it's too late. You can still get started and we can help with that.
Yeah, and the whole topic is the risk assessment. If you haven't started that, well, it's not anywhere near too late, but definitely start it now instead of waiting till the last minute, which is one thing that I'm really good at. And I have learned repeatedly it's a bad idea to wait until the last minute. It's one of those do as I say, not do as I do. You'll be happier. All right, well, that's all I can think of. I know sometimes I can talk and talk and talk and talk. But for today, that's all I can think of. Were there any questions that popped up, Tabitha?
Not at this time.
All right, so we'll be emailing you those 2 downloads. Thank you so much for joining us this afternoon. We appreciate it. Let us know if there's anything at all we can do. We love working with all of you all, and we want to make sure that we can help you make this as easy as possible, because we know you have lots of other things to do, and that any time we can free up for you means better patient care, and that's our goal. So, thank you so much.